Hello, and welcome to Stories from the View, a podcast from the Pleasant View Senior Center in East Longmeadow, Massachusetts. On this podcast, we invite East Longmeadow residents to tell us stories about their lives and events. And today's guests are Karen Fisk from the SHINE program, that's serving health insurance needs of everyone, and Erin Koebler, the director of the Pleasant View Senior Center here in East Longmeadow. And here's your host, Ed Fitzgerald.
Thank you, Eric. Good morning, Karen.
Morning, Ed.
Good morning, Erin.
Good morning, Ed.
So, up until I turned 65, I thought the worst time of the year was tax time. Then I was introduced to Medicare and open enrollment. And what a tough thing to deal with. But a couple of years ago, I went to a SHINE presentation. And it was like, wow, now I understand. And the presenter was you, Karen. And I thank you for what you did then and what you continue to do. Open enrollment is coming up. What is it that we all need to be aware of?
Okay, open enrollment, as Ed mentioned, we want to make sure our taxes are done by April 15th. Open enrollment, October 15th to December 7th are the magic dates.
Every year.
Every year. And there are some exceptions, but we'll get into that a little later. But open enrollment is a chance for people to review the supplement that they have to Medicare and to decide, is it still working? Is it the best program for me? And it is really becoming more important to review because generally, we have a prescription drug plan, or if we are in Medicare Advantage, it includes our prescriptions. But every year, it seems that insurance companies change their formularies or could change their formularies. And so the drug plan that we had last year may not be the best one for the year coming up. So open enrollment is really an important time for people to look at that.
So to look at what they currently have,
Right.
look at what's available, and what they currently have could change, could be
That's right.
changing.
That's
So
right.
they've got to look closely at that.
Absolutely. And that's during that open enrollment period is when the new plans come out for the following year, as Karen mentioned. And not only are formularies changing, but I think insurance companies are changing pricing more than ever, wouldn't you say?
Yes,
So
definitely.
you're seeing bigger cost savings as you're looking at changes in a participant's health situation with what they currently have compared to what might be available in the next year.
Good. And the other thing Erin mentioned as our health situation changes, that's another reason to evaluate whether the plan that we have currently is the best plan for us to go forward. Because there can be some significant differences.
So this all starts with Medicare sending out the information about what the plans look like for next year.
For the following year.
And
Yeah.
that has come out. No, that hasn't come out yet. We haven't received. I got an email the other day, but I don't think it was just giving me a heads up that this is coming.
Yes, every year people get Medicare and You book. Now, I don't know if anybody or how many people really read that book, but it does contain everything, a lot of stuff, but it can also overwhelm people. You also may have had the option to get it by email, so probably people that signed up for Medicare to get it by email, you might get that before others.
actual paper book
other
comes
the
in the
the
mail.
paper book.
Yeah.
Paper book comes
So
in.
when did the SHINE presentations begin here at the Senior Center? Is there a schedule that's been set yet, or?
We have a schedule of open enrollment appointments, and Karen's usually available 2 days a week, 2 appointments each day, correct? Starting the week of October 15th. And then I do about 2 appointments a week.
Okay.
But we will not have our official Shine training on the new plans until I think October 13th, Friday, October 13th.
Okay.
So plans are sort of sliding in to home base at the very last minute with their new plan changes, and often even at that training, plans are sort of saying we're working that part out. So we don't know much about what the plans will look like at this point in time, and we don't until really October 15th. People are very anxious to get those open enrollment appointments, but we really can't do much until open enrollment officially opens.
Right. And the other piece of that, which we sometimes don't even know till much later, like November, December, is for, again, most of us that have Medicare, there's 2 parts on our card. It says Part A, that's a hospital part, no cost, and it has the effective date. But Part B also has an effective date. Part B does have a cost, and that cost changes every year. So, we can't tell you what next year's is because we don't know. And we might, even during open enrollment, we won't be able to be precise on that. Although it doesn't change that much. I mean, it's, but still, there is a change that we won't know for that Part B premium.
Okay. So there's Part A, Part B, and
All
then
right.
there's Part D.
All right, let's go
start at
through
the
what
beginning?
A,
Okay.
A, B, C, and D is. All right. So Part A, hospital insurance. So first one, Medicare generally pays 80% of the approved cost, whether it be hospitalization or whether it be medical services. And so we are then left with 20%. And I like to say to people when I'm meeting with them, if Talbot said that I only had to pay 20% of an item, I would think that was a great buy.
Great benefit.
And I wouldn't be able to not go. But with
We found your weak spot.
oh, it
Karen.
definitely
Talbots.
is. But with hospital cost or doctor costs, 20% could be a big chunk. So that's why we get supplemental insurance to help us, if we can, to pay for what Medicare does not pay for. So Part A is hospital insurance, and Part B.
Part B is physician insurance, so going to see the doctor, going to see a specialist, some of those other even
Lab tests,
things like that.
MRIs, emergency room, ambulances, that all falls under Part
Urgent
B.
care.
Urgent care.
Okay, so Part A,
So-
Part B,
All right.
and then the supplement.
All right, well, so we have to have A, B, and we have to have a Part D, all within prescribed timeframes, so we don't get a penalty. Part D is the prescription insurance, prescription plan. And we do want to say, in counseling with people, they'll say, well, I don't take any prescriptions. Whether you take a prescription or not, you need to have a Part D, an insurance plan. It can be pretty low cost. But if you don't take it, when you're
eligible.
need it, for this year, I think for the first time, I had somebody who was like 2 to 3 years without having taken a prescription plan. So you get penalized. That never goes away. So every year, a certain amount will be taxed on to her Part D plan, and that amount will never go away. So we need to have A, B, and D. So what's C?
What is C? So that is, I explain it, and I'm not sure I'm explaining it. This is sort of my words, as bundling part A, B, and D, right? So it takes A, B, and D and puts it into a Medicare Advantage plan, which could be an HMO, a PPO. It has usually a network of providers, and it may have one premium, or it could have a zero premium, $0 premium. And it's great for folks who are relatively healthy for the most part, because it does usually have some co-pays, some out-of-pocket maximums that people need to meet, maybe some deductibles, but it's that sort of bundle plan for the A, B, and D.
So if you don't get Medicare Advantage, if you don't get that bundle plan, you do have another option. And that is what they call original Medicare with a Medigap policy. Many insurance companies offer the Medigap policies. The only difference is the cost. So, we try to say that to people. When we were in training, and I'm pretty sure we were in different training, but I'm pretty sure the message was the same. If somebody comes in and says to you, my friend says this, or my sister says this, you can almost know it's not true, or it's not correct. It could
At
be
least for that.
It could be true,
that
but
you're
it
seeing,
Exactly.
right?
May not apply to
because
you. Right.
everybody's plan is unique. Like, most of us who are married or have worked, husbands and wives have always had the same insurance. When it comes to Medicare, that's not necessarily the rule of thumb.
And it is it's a very strange phenomenon for people to wrap their heads around too.
Correct.
Where one spouse has been sort of covering both of them through their work.
Right.
So Medigap and supplement.
Okay. So, right. Medigap is a supplement.
Is a supplement.
And Medigap, there are, I don't want to get too detailed, but there are 3 different levels of a Medigap. The core is the first level. And with core, you are responsible for the Part A deductible if you go to the hospital. This year, you'd be responsible for the first $1,600. But then after that, you do not have any co-pays. You are also responsible for the Part B deductible. And remember, Part B covers a lot of things. And the Part B deductible this year is $226. But if you think of it, once you've hit that $226 mark, you call an ambulance, no copay. You go to urgent care, there's no pay. You go to a specialist, you go to your primary, there are no copays. If you do decide to go the supplement with either a core or the supplement 1, you would need a prescription plan.
I'm already feeling like I
I
have to
know.
make my appointment.
Yeah, I know.
Get it now because they're feeling it.
Yeah, so I don't know how much.
There's a little more flexibility with the supplement plan because you can go to any doctor or hospital, use any provider that accepts Medicare for payment. With an Advantage plan, you are restricted to their network, and sometimes in this area and other areas, that means you're self-selecting out a certain hospital.
Right. But what I discovered was that there's a difference in the Advantage plans. Some are
definitely.
really good plans, and some maybe not so good.
Right.
They're actually harder to compare
Right.
right next to each other
Exactly.
than the supplement
Some are
plans.
corporate, some are individual plans.
So
What the company that I was with offered a plan this year for the first time.
Yeah.
And it's a corporate plan. And as I did the comparisons, it looked a lot different than other plans that I might sign up for as an individual.
Right.
So
We're
that's
very
another thing
careful.
to consider.
Right.
Yeah.
I was just,
We
that's a
are
good-
very careful when people come in and let us know that they do have a retiree plan. We really try not to mess with those, because once you decide to leave those plans, you often can't get back in.
An interesting thing that I found out, it's first year that I signed up for an Advantage plan, and if I read the fine print correctly, if I decide that I don't want to continue with Advantage plans, I can change it after the
That's
first
right.
year. I can go back to the Medigap supplement plan.
Okay. And, that's with your plan, because generally, I want to say one thing and then I'm going to respond to that, and if I don't, help me. Again, even if somebody calls the office here to sign up for a Shine appointment, the receptionist will ask or say that if you're a part of a state plan, Mass Mutual, or even any, GIC or a municipal plan,
Aon, yeah.
Shine cannot, we can tell you the basics, but we cannot get into the specifics because we don't want you to lose your benefits. So we don't, and sometimes it's really awkward to say, you always hate not being able to help, but that was really ingrained in us.
It's for the
Just
benefit
let it
of the
go.
person
Yeah.
who has a retiree plan, and their retiree benefits person really knows the most about that plan.
Right. Now, another
So-
very important piece of open enrollment, when we mentioned the insurance, we mentioned the prescription, but sometimes, people at 65 can be very young and very healthy and not have very many health needs. So they may choose a low-cost Medicare Advantage plan. But as we get older, all of a sudden the knees go, I don't know what else goes. The knees go, the hip goes, or, the doctors are suggesting more and more MRIs or CAT scans. That Medicare Advantage plan then may not be the best because you're going to have copays. And so
Deductibles.
you can, during open enrollment is a time when you can change from that Medicare Advantage to the Medigap or the Medigap, either core or the supplement one. So that's another reason why open enrollment is important.
Good. That's good to know. But as far as the Medigap and supplement, that's interchangeable, the terms. Okay, I just want to make sure.
Yeah.
Yes.
Yep.
So
Absolutely.
the interesting thing I learned about it, the Advantage plan, is the way it works is my plan is no premium. I say, wow,
Yep.
that's a good deal. Plus I get some dental, I get the health club, the whole thing. But the way it works is the government gives the insurance company a set amount of money. Now they manage the whole thing.
Yes.
They make the decisions. Whereas before, there wouldn't be a question of whether I was going to get care through a supplemental plan. But now United Healthcare could say, well, I'm not sure that you really need that MRI or whatever it is. So you're kind of at the mercy of the insurance company.
Yeah. As you were talking, Ed, again, two thoughts popped into my head. One is, even yesterday I was meeting with somebody new to Medicare, and I said to them, I would not choose my plan based on the extra benefits, whether it be fitness or even dental or vision. And as a Shine counselor, I have to say, I can't even tell you what some of those benefits are. I don't get into the nuts and bolts of those. We have too many other
many
pieces. But anyway, they're nice, but again, I wouldn't choose my plan on that because sometimes they're not as comprehensive as you would think.
Yes.
But I do want to just talk about Medicare Advantage again just for a minute. As Erin mentioned, there's an HMO, health maintenance. I go to my primary care doctor and I need to see a gastroenterologist. So they're going to refer me to a gastroenterologist in that same network. There's also a PPO, and a PPO provides more flexibility. With a PPO, I go to my primary care doctor and I need that gastroenterologist, and they suggest a certain one in their network. But I've gotten many referrals from somebody about a doctor that's out of network. With a PPO, you can go out of network. It's just that your copay is going to be higher. So the Medicare Advantage does have those two options. With the HMO, you need a referral. With a PPO, you don't need a referral. You can go out of network. And speaking of referrals, that's again one of the advantages to the Medigap plans. No referral is needed, and you can go to anyone that accepts Medicare throughout the United States.
Country.
If you have a Medicare Advantage plan and you're traveling, if you're outside the network or outside the area, emergencies will be covered, but not routine.
Okay, I'm glad you brought that up because my Advantage plan does cover out of network. Okay, so that was a consideration. I didn't sign up for all the bells and whistles. In my case, the way the company offered it, there was other money involved, and that was a consideration as well. So this is a good example of how an individual situation needs to be evaluated.
Absolutely.
Where the Advantage plan worked for me real well this year, but it might not work for other people because their company is not involved in offering the plan. So
It's all very individualized.
yes.
We sort of start by talking about people's health situation, the prescription drugs that they're on at that moment when they're meeting with us is a great way to sort of start narrowing down plans. Whether they're going to go the route of Advantage Plan or Medigap, it's a nice way to sort of start comparing because the Advantage plans are all so very different that it really is very difficult to compare them side by side unless you have a way to narrow them down a bit. So, the prescription drugs that somebody's on today are one way that we can sort of do that. It's a picture of their health in this moment. And then we look at which hospitals do you prefer? Do you want to be able to have access to Baystate and Mercy, or do you really not care? Or and then we look at, does your doctor accept this plan?
Right.
And those are ways that we help people sort of narrow down the choices that they have until they're at a manageable level where they can actually compare.
As Shine Counselors, Medicare actually does help with a very useful tool.
Yes.
If someone hasn't set up a Medicare.gov account, we generally start out by helping them establish a Medicare.gov account. It's not that complicated, really, but we then are able to put in all your prescriptions, and then those stay there. So every year you don't have to re-enter. It's there. Yeah, which is very helpful to us.
I'm glad you brought that up because that was been my experience in using that.
And then
It's a great tool.
it's once we put in the prescriptions, it can tell us drug plan, give us options for drug plans. It can give us options for Medicare Advantage plans. And then, as Erin said, then we have to try to help people narrow it down into, does your doctor accept it? Do you have a preference for hospitals? Are you traveling?
Do you have a knee replacement scheduled for next year?
Right.
Right.
If there's a surgery that is upcoming, also plays a part in which
Right.
kind of plan you might want.
Right. So if if you sign up for a Shine appointment, you're sent some paperwork ahead of time, and it basically asks about your prescriptions. There will also be a question asking about your income and assets. And it's not because we're curious. It's it's because by answering that simple question, we as Shine counselors have then screened you for other benefits. We've screened you for Mass Health. We've screened you for, there are some programs that will help with high prescription costs, or even to help with some of the deductibles. So if you do sign up for a Shine appointment, that paperwork is very helpful and very important to us in order to help within the period of time that we can meet with you.
Absolutely. There are even programs that will pay for the premium for Part B, that premium that's $164.90 this year. So we can really quickly sort of take a look and see if we need to investigate further.
So the kind of the way I look at the open enrollment is just somewhat of a process. I look as soon as I have the information, I take a look at it and try to make some kind of initial evaluation. And then just over the days and weeks leading up to the deadline, which is December 6th? 7th. And what I try to do is to get it all done by Thanksgiving so that, I don't have to.
You don't have to think about it through the
Don't have to think about it.
holidays.
It's a good, as I hear about things or look at things or go and have an appointment and get information, I may make some tweaks or adjustments to, what my thinking might be. And then by Thanksgiving, get it done.
Yeah.
And actually, even now that I think about it, you make your decision through the system online, on the website, correct? That's where you
can.
Right, you can.
Okay.
There are, we
Often
experience many people that want nothing to do with
I would imagine you
computer.
do, yeah.
And even people who maybe are familiar with the computer still they're not comfortable with it. So if you can, Medicare.gov, and you can navigate it yourself, that is great. But, we're kind of here to help people too who, that's like, don't go there with me.
Yeah.
So then what do they do? How do they make their?
We help them.
Oh, you do? Oh, okay.
Yeah, we can help
We help them. And, Shine is kept pretty busy. So we're not necessarily looking for work, but if you do feel like you want a Shine appointment, you have to call. The open enrollment appointments get filled quickly.
Very quickly.
And if we can't service you here, you'd be given the number to the general Shine office. But truly, all the Shine sites seem to get really booked fast.
Are you accepting appointments then?
Appointments are open now, so
they should
call the senior center.
Call the senior center.
Yep, for an appointment.
Okay.
413-525-5436.
Yes.
I always have to look it up.
Cool. Okay.
And just often it comes down to really just math. Sometimes Karen and I are just sort of working on a math problem by the end of figuring out, sort of seeing what people's health situation are, and then if you're really stuck, it ends up just sometimes being a math problem,
Right,
which is great. It's
Actually,
it's
the
so gratifying.
couple I met with yesterday, I literally, made 2 columns. If you do the medical supplement, this would be generally what your monthly bill will be. If you do the Medicare Advantage, it could look like this, the monthly. So sometimes and I even laughed because I got out the calculator and I say, I'm actually better with a pen than I am with the calculator, but the calculator was sitting there. So
And how long is an appointment generally?
an hour.
An
We
hour.
try to keep it to an hour.
Okay.
If the staff here is so wonderful. But so, like I was speaking with Marilee, and if a couple will call, Marilee will give me a heads up. So we might try to have them come in a little earlier because it can go a little longer if it's a couple.
Can I make my appointment now, or do you have the schedule there? No.
Just right around the corner.
It's right around. Yeah, I mean, right
on your way.
That's the beauty of my volunteering here. Is like somebody will say to me, "Can I get?" I have no idea. They keep my appointments, which
And
is
I think
wonderful.
that's a great segue. Shine volunteers are part of a nationwide program called SHIP, which is State Insurance Health Program, State Health Insurance Program. And so they give funding to the states to be able to do this Medicare, unbiased, free Medicare counseling. And so all of the people like Karen who are giving these, giving their time and amazing service are volunteers, right? So she went through the training on her own time. It's very intensive training. We meet every month to continue having training, and then during open enrollment, we have another hours-long training from all the plans, right? So Karen and all of the other Shine volunteers are really generously giving of their time, and this is a huge service, and sometimes we see people save thousands of dollars by choosing a new plan for the next year, and it's so amazingly gratifying and life-changing for people. And I just want to thank all the Shine volunteers who give of their time to do that for folks. It's a huge service.
It was, yes. So any last words of that you'd like to, I mean, open enrollment begins on
October 15th.
And decision needs to be made by December 7th.
Right.
Okay, so people should mark that on their calendar.
Right.
They should make their appointments.
I'm sure if they watch television, they'll be inundated with
Good
reminders.
point.
But yeah,
The anxiety that the commercials cause and the mail that people get by the end of open enrollment, you have a pile on your dining room table as tall as this microphone.
I often have to say we don't. Our house is a pretty quiet house. We don't watch much television. So when somebody says, "Well, I heard on television," that I said, "Well, I don't know where that plan is, but it's not in our books, you know." But they will be reminded about open enrollment.
A friend of mine said she was so sick of hearing Joe Namath talk about the supplemental plan.
Right. But we want to thank you for the opportunity to get out this information. It's
good. Well, thank you. Thanks for being here today.
welcome.
And I hope everyone gets some good guidance from what they hear. Have heard.
The appointment or the phone number here at the Senior Center to make a Shine appointment is 413-525-5436. And then if our appointments are full, they will guide you with the number for the regional Shine office. You can also try going on to Medicare.gov. I know that last year Karen and I helped many people set up accounts, and I think some people left feeling very confident that they could do some of this work themselves. So don't be afraid to try it. You're not gonna do anything if you just go in there to look and sort of play around with your drug plans.
That wraps up another episode of Stories from the View. We'd like to thank our guests, Karen Fisk and Erin Koebler. The Stories from the View podcast is available on the LCAT 01028 channel on YouTube and on Spotify. If you have a story you'd like to share on the program, contact Pleasant View Senior Center Director Erin Koebler by stopping by the Pleasant View Senior Center or by calling Erin at 413-525-5436, or you can send Erin an email at erin.koebler@eastlongmeadowma.gov. Thanks for listening, and we'll see you next time on Stories from the View.